Hey everybody, welcome to my channel. I created this channel for HS awareness and mainly for the cause of supporting doctors and governments to do more research into this skin disease called Hidradenitis Suppurativa. Also short for HS, so I will be using the term HS a lot. And I will explain in this video a little bit about what HS is. So HS is an auto-inflammatory skin disease. Often it's confused with the autoimmune disease. Autoimmune diseases are a little different than an auto-inflammatory disease, but they are similar, but they're not exactly the same. So with auto-inflammatory diseases, you see a lot of infections, you see a lot of reactions from the body, creating inflammatory results. And with HS, you see this on the skin and in the deeper layers of the skin as well. So not only on top, but also in the deeper layers of the skin. So there have been quite a few studies done on this disease, but nowhere near enough studies. And most studies that they have don't have any hard conclusions. So they used to think that hidradenitis suppurativa was an infection of the sweat glands. And recent studies from the last 10 years actually show that it has nothing to do with the sweat glands. They can get involved, but it's more a secondary thing. Now, what they found was that it's an infection in the hair follicles. And what they think is that there is a blockage in the bottom of a hair follicle that fills up with sebum and sometimes in some cases bacteria, but not in all cases. And because it's blocked, your immune system reacts to that with an inflammatory reaction, which can create really big inflammatory spots on your skin. HS comes in different stages. For example, stage 1, where you have like spots on just a few places of your body, most of the time in armpits or in your groin area or around your breasts. And those are like singular spots. Then you have a stage 2 where you have more areas of your body infected. You could also have it around your bum, in your neck, in your face, on your back, in the creases of your arms, all different kinds of spots. And with stage 2, you will see tunneling, which is like a little tunnel under the skin from one infection to another, and then it tunnels all over your skin. And so with stage 2, you have different spots with some tunneling going on. Then you have stage 3, and with stage 3, you have giant spots with a lot of tunnels underneath with all different infections, creating one big infection, one big inflammatory area. I'm saying infection, but most of the HS inflammatory spots are not a real infection. They're just a reaction of the autoimmune reaction of your body, and they don't contain bacteria. With 50% of the areas with HS, they do contain bacteria, but what doctors think now is that that is a secondary reaction to the inflammatory reaction in your body. So it's like something that happens later on and then can make your HS spots get infected. So this disease is not very well known on the wide public because they used to think that it's only 1% that is having this disease. And that was mainly because it was misdiagnosed in many cases. A lot of doctors said it was acne, or said it was a staphylococcus problem, or a streptococcus problem, or those kinds of things, and they mainly gave just antibiotics or do some operations, and that was it. So now this disease is getting more and more out there. More and more doctors know about it. More people get the right diagnosis, and this number of the 1% is actually inclining because of that. So HS has been there for many years, but many people just don't know that they have it. They just think it's something else. So it's a good thing that there are more diagnoses, because as soon as they know this disease is happening with more people than they think, then more pharmaceutical companies think it's interesting to do studies into this disease and into treating this disease. So there are a couple of treatments out there right now, but there's no cure. So this is really important to tell, that everything your doctor can give you can bring you into remission, but it will never cure your HS, because it's an autoimmune disease. So there are a few different treatments. There are a couple of types of antibiotics that they can prescribe you, mainly when your HS is infected. And I would suggest, from my own experience, to not take too many antibiotics for non-infected areas, because an antibiotic is a type of medicine that you can get a resistance for, so then it stops working. And if your spots are not really infected with bacteria, then sometimes antibiotics are given for decreasing the inflammatory effect, but be careful with the overuse of antibiotics because of the resistant problem. Another thing that can give you is Accutane. Accutane is actually a vitamin E. You actually toxify your body with a high dose of vitamin E, and it's supposed to dry out your HS. Well, this actually can work with stage 1 for some people, but Accutane is also a very severe drug, so only do it with the good supervision of your doctors. You need to have blood tests and blood work done all the time to check if your levels are okay, and you can't come in the sun with it, and you can't get pregnant with it, because it will kill your baby, or you get like babies with a lot of problems. So it's a hard drug to take. Then the recent outcome is that they now also use biologicals like Humira, infliximab, Remicade for HS patients. And I think personally, my personal opinion is that if you have like a severe stage 3, that can be an option for you. But I would suggest to ask your doctor to first remove all your active infections or active inflammatory spots with surgery before you start Humira, because then the chance is higher that you will get in remission than when you would just start the Humira. And Humira is actually injectables. So, but for all these types of drugs, they're kind of a Russian roulette. So on some people they work and they go into remission, and on some people they do nothing. So I'm one of those people, sadly, because I have so many spots. I can't use Humira. I used a lot of antibiotics which worked for a while, but then I built up a resistance, and Accutane did nothing for me. So then there's also different types of surgery that you can do. You can get your infected areas lanced. You can have like the deeper, they can cut them out deeper. So you have all different kinds of surgery as well. So for the people that don't know this disease, as you can hear, it's quite invasive on your life. They did many studies on different types of skin diseases and the quality of life people have with that. And hidradenitis suppurativa is the number 1 on people with the most depression, the number 1 on people with the most pain, the number 1 on people with a shame about their disease, the number 1 of people who get in trouble because it's a lot of work to take care of all the wounds, to take care of all the infections, etc. A lot of people can't work because of their HS. So it's one of the most invasive skin diseases out there, and it's extremely, extremely, extremely painful. And because this disease is so aggressive and so painful, I felt the need to start researching other options for treatments. So I tried a lot of diets, I tried a lot of alternative medicine, I tried all different kinds of stuff. But now I'm going to do this new treatment, or actually it's an old treatment, but it's an old treatment that is getting new attention in the Western medicine world, called bacteriophages. And I'm being studied by HS research doctors while taking it. And this is actually what I am trying to do, is to get more HS patients helped with treatments that are not as invasive, that don't have as many dangerous side effects as the medicine already out there, and that you can use chronically to at least get a little control over your inflammatory spots and your infections and all those kinds of things. So bacteriophage is actually a thing that come in handy with these kinds of things. So I'm going to try it out. I'm going to blog and vlog a lot about this. I'm going to try to speak to all of the doctors, to also ask them questions on camera, and to share this with everybody who is interested in seeing what's out there for HS. So if you're a patient and you want to tell something about your HS, or you have questions, send me an email, or go to my Facebook page. If you type in Help Suzanne on Facebook, you will find my Facebook page. You can also reach me there. And if you have any questions, let me know. So for now, I wish you a good day, or a good night, or a good morning. And I will make a new video soon. So bye everyone.